Well, welcome to the 16th episode of All Things Crypto and Elk Finance Podcast. I'm Shylo, also known as LtSnakePlissken, and today we're discussing crypto, health, and wellness with our special guest from Galvan, the CEO of Galvan, Dr. Adam Sharp, MD. So welcome.
Thanks. Glad to be here.
Yeah, and before we jump into this, because it's a really interesting topic for a lot of us, and especially for those of us who have some association with the medical field, I gotta mention that we're not financial advisors, and this is not financial advice. If you're looking for financial advice, find a licensed advisor. We talk about a lot of crazy things on here, so gotta pick and choose. So I guess the first thing to ask is what inspires a medical doctor to get into the Web3 environment?
Yeah, well, great question. So as you mentioned, I'm an emergency physician, have practiced emergency medicine, depending on how you quantify it, 10 to 12 years to 15 years, if you include training and whatnot. I'll tell you a little bit about my backstory. Hopefully this isn't too boring for everyone, but I was the first person to go into medicine in my family. And so was excited about it. My best friend's dad was a doctor. That was kind of my closest, and I'd been to the doctor. That was about, the extent of my experience, and really was excited about going to medicine, and did a bunch of work to know that was what I want to do. And my intentions were to go and practice medicine and become a good doctor and take care of patients, which is so important for a lot of reasons. As I got into my training program, I was trained at two hospitals. One was a county hospital and one was a community hospital. And the same faculty taught at both hospitals. And it was amazing how different the medicine was that was practiced. Literally, these hospitals were a mile apart, very similar patient populations in some regards. And I thought, when I was training, I was like, boy, why is this so different? We're same faculty, same area, same city. Why is the medicine so different based on the system? And that led me to have interest in research and science, which is supposed to be objective assessment of what works, right? Like, isn't medical science supposed to help us know what we should do? And if we know what we should do, then why would medicine be practiced so differently at these two hospitals? And so I went on to do, it's changed a little bit, but something called the Robert Wood Johnson Clinical Scholars Program. Got a master's in health and healthcare research at the University of Michigan. And then as I've been trained in research, the research itself shows most people don't read it and do anything about it. So there's this paper that's quoted by a ton of people that it takes 15 years, or I think it's 17 years for about 15% of research to get to the bedside.
Wow.
That's not perfect. There's things that, have been expedited, but the reality is that we know far more than we do in medicine. So that led me to come out to an integrated health system in California, where I've worked for the last almost decade now, until I just came over a couple months ago to Galvan, because we had incentives to actually help keep people healthy. It's different than most fee-for-service models in the U.S. health system, which aren't bad. It's just that the way the incentives work are to do things like do surgery or do procedures or do more medicine. And it's actually rarely there's attempts at policies to try and change to actually get better patient outcomes, which are rewarded, which is what everybody wants. So that's what got me out here. And then the pandemic hit and nobody knew what to trust. It was hard to know. There were literally millions of articles in the National Library of Medicine on COVID, but from all sorts of perspectives, very news. And as I saw that, and my mission was really to just provide the clinical training that I had with the research training to help people get the outcomes that they wanted. I think that's what the Web3 and the blockchain presents, really amazing opportunities in that space for people to trust the information they're getting, to be far more transparent than the current health system offers, so that people can be truly informed about everything from the risks and benefits of what's going to happen to them to the costs, frankly, which have grown out of control. If in the United States, we're spending $8.3 trillion in healthcare a year, it's just not sustainable. And we know that based on their own estimates that maybe up to close to $1 trillion of that's just pure waste. So anyway, that's longer than I should have gone on about myself, but that's been my path through medicine to research to the blockchain. And I think the DeSci movement, where the decentralized ownership and transparency of outcomes and information, as well as incentives to get people to do healthy things. We'll talk a little bit more about the move to earn space, or move and earn, as we like to say, is awesome, because we all know we should be exercising, but frankly, sure, sometimes we need a little motivation. So we're really, that intros into why I came to Galvan, which is really just to try and be a decentralized. Here's the summary of what I've done and what I hope. As a physician and a researcher, my family and friends call me all the time to ask questions. And when my family has been sick, and in some of the worst times of my life, I feel like because of that training and education, I've been able to make informed decisions that were, it doesn't mean that the best decisions always have the best outcomes, but at least I felt comfortable with what I was doing. And I think everybody should feel that way. Everybody should feel confident that they have all the information they need, and they have all the resources they need to really get the best care that they want. And that's what we're trying to help facilitate.
Cool. Yeah, that's really interesting, and it's, you know, such a different path to come from, you know, to connect that without your story, you know, to come from a medical background and then go into blockchain. And I'm with you there too. I mean, I'm a family counselor by training, you know, and so I've made the move, you know, to crypto, and of course, you know, I'm still doing both at sometimes, but you know, it's kind of funny how it brings really everyone in terms of you know, DeFi blockchain, brings everyone in to collaborate, and you can see it as a potential solution for a lot of different problem areas in our system. And you know, and I don't see all of the flaws that are necessarily present in the American healthcare system, as I'm actually Canadian. So it's slightly better in some ways. No insult, but I mean, there's definite you know, ways in general that people could have more access to their own information, and how we could improve, you know, outcomes by just giving people the resources and motivation to make healthy choices in a variety of situations. So I guess that brings us to kind of the next question here. What does the blockchain have to do with health and wellness?
Yeah, so it's a really good question. I get this question a lot. And I guess I want to start with, the blockchain doesn't replace physicians and hospitals and medical procedures that are necessary for given diagnoses, right?
Yeah, so Binance can't do surgery.
Yeah, that's right. That is correct. So there's no question that there's some aspects of healthcare, US, Canadian, international, whatever it might be, that the blockchain doesn't solve. And here's a few examples. If you live in a place where you don't have access to certain physicians or certain healthcare, the blockchain won't solve that. Now, there are some exceptions. Telehealth, for example, you know, rewarding people for doing things so that might improve their opportunity to be able to use their digital rewards to get certain services. Sure, that part, yes, there's a part of the solution, but sure. But where I see, you know, Web3 and the blockchain really having major advantages in the healthcare and wellness space is that it doesn't get filtered through an organization or a group that has their own bias. Now, we all have it, even if not nefarious or malintended. It's just the reality of the fact. And so I think that's where the transparency and the decentralized format of the blockchain is really one of its primary advantages, in addition to the fact that we now have digital rewards that we'll talk a little bit about with Galvan that can help incentivize people to do things. Sometimes they may not know what to do. Sometimes we know and just need a little to make those decisions and to do those things. And I think that's where the blockchain is really advantageous.
Yeah, totally. Just an open resource. You know, the transparency of it all and accessibility is something that is, you know, really available with a decentralized web. And yeah, interesting points there about like giving people some motivation through, you know, what we'd call positive reinforcement, right? Motivating them to make those choices that they know are healthy. They know they got to drink more water. They know they got to go for a walk. But then how do you traditionally incentivize that? Because as we know from all of the research, people are terrible at making choices that don't result in short-term gains. And the long-term gains are so difficult for us, like the it all holds true, that study with the kids in the marshmallow, right, or the cookie, where
you wait for your second marshmallow, or you're going to eat the one. Yeah,
no, gotta eat the first. Yeah, so unlikely to eat to wait to get 2 marshmallows, and that's all of us, I think, and maybe more than 2 marshmallows, in my case. Yeah, so I guess that kind of leads into Galvan. Tell me a little bit about that.
Yeah, so we have a very ambitious mission. The short version is that we really hope to. There's a lot of use cases, but the 3 primary and principal things that we're trying to work on right now are, number one, to motivate people to be able to do things, and we'll talk about that, but through an exercise application where we can reward people in a move and earn opportunity. So essentially, we know there's really good data about people, and again, as a researcher, I'm a little more critical of the data, but if you get 150 minutes a week, and people are like, why 150 minutes? Wouldn't more be better? Probably, but there is a too much realm out there too. But what's been studies at 150 minutes, if you get 150 minutes a week, you get about 30 minutes a day. That really has huge health benefits, and we can track that. Not everyone, but most people now have some version of a wearable, or at least a wearable, and we can proof of action. We can actually track your heart rate. You get your heart rate and that exercise rate for a time. So we want to motivate people through our initial offering, which should be available soon. We're still working on the beta version, but where we can plug into your wearables and reward you with digital currency. So like you said, move that, instead of waiting a year to say, hey, I've got more energy, I'm more fit, I feel better than I did a year ago. It's a more direct and immediate reward that helps people to do what we already know. Everybody knows they should be exercising. I don't think it's news breaking, but the motivation and the opportunity with digital rewards to be able to reward people is novel on the blockchain. So motivate is one thing. The other is to help people, to empower them. And I say empower, there's a couple different ways that we plan to do that. So one of our partners that we are in the process of working with right now is Canary voice recognition. We know that mental health right now is at an all-time worst, as you know that through your own professional training. COVID and the pandemic and everything it has brought has made that worse based on what we're seeing for everyone. This company, and again, not to let too much out of the box, but it's really good. This is one from my background. People don't really understand the pros and cons of even how a physician makes a diagnosis. It's not perfect. Some diagnoses are spot on. Sometimes it's a gray area and we're not sure. What we do know is we have very good surveys to look at anxiety, and the GAD-7. GAD-7 is what is typically used in a primary care setting to assess for anxiety. And the PHQ-9, which is typically used to assess for depression in the primary care setting. Those are things that typically people have to go to a clinical setting and talk to a doctor in order to get. We know that depending on how often you go see the doctor, those are important things, and those should continue to be done. So I'm not saying we replace those, but we think that through voice recognition that can identify with those types of surveys based on open-ended questions can help people to actually self-assess. So to be at home and be able to reward them for checking in and looking after their own mental health and wellness. So using novel tools like voice recognition to assess your mood and to assess your stress levels and your energy levels, which are the first 3 things that we're going to work with. There's a lot of other possibilities, but those are the first ones we're going to focus on. We think that's great. Again, back to using digital currency, digital rewards in order to motivate people to check in with themselves using medical science and tools that we know work so that they know where their baseline is. And so that's the second one, is to empower people with new tools for self-assessment and self-awareness, and be able to reward them for taking care of that. And then the last one is, I would say, is to inform people. And it's not that there's not infinite information out there for people to go and find, but often we don't know which information is relevant. We don't know which information we have. So that's part of where we hope to offer a personalized health record, where people can be given tailored information. Often, I've spent the last 10 years in trying to present information in a way to physicians and the health system to try and make the right decision for patients. Really, what we hope to do with Galvan is to present it right to people and to patients. So they come in informed, so they have informed decisions. Often, as a physician, people come in and they don't even know what to ask them.
Right.
And they ask the wrong questions, and they're well intended, but I'm thinking, I don't want them to think I don't care about their question, but they're not asking me the right question. They're asking me, their physician, things that are for other people. And that's where our last in inform, we hope to be in the learn and earn space. So we would love to be able to reward people with digital rewards who are willing to learn about hypertension if they have high blood pressure, or diabetes if they're borderline diabetic, or pick your condition, where we can present objective information, tell them the pros and cons, tell them the recommended medications, the risks and benefits of them, the costs of them. So we're not there yet, but in my vision of what Galvan could be, it's a community where really, again, we're decentralized, node owners, which are going to be decentralized. We're truly moving, as the CEO of a company that truly wants to be decentralized and truly the form of a DAO, I hope to get myself out of the way so that this can be run by the people. But obviously it has to start somewhere. And so our vision is to be the health and wellness blockchain where these types of transactions can be owned by the people, observed by the people, and done in a way that we can incentivize healthy actions and inform people to actually make the best decisions that are up to them as they interact with physicians, as they interact with the health system wherever they might live.
Yeah, and it sounds like, there's certain valuable pieces here, like having, certain people like yourself looking at what information is coming in, what's published within there, what's, scientifically accurate and what's not. A lot of like, I'm going to go on this GeoCities looking website and it's going to tell me about these remedies that may not be the most healthy or sustainable. So it's kind of seems to be combining that open source piece with directed by professionals who kind of know the research and are having at least able to find the relevant academic sources and present them directly to the user in a way that they can understand.
Yeah. I think that's well stated, and I think what we are trying to do, and again, this is a future state, but wouldn't it be nice in the same way that Web 2.0, we can get on and start to search for something and it comes up?
Yeah.
If we got tailored information to us that wasn't filtered through someone who might have a really strong financial incentive based on the decision we make, right? And I don't think that those, again, back to, it's not that people are nefarious, but it's just the reality of the system.
It's capitalism and how it works, right? It's profit above all. So
it is, and so I think this is that's where really what we're trying to do, and really the blockchain and Web 3.0. I'll say this honestly, like, we want health and transparency and wellness to win, and we want to work with others that are. I think, that shouldn't be a competition. There shouldn't be winners and losers in that. Everybody, this is my own, maybe a little bit too ambitious perspective, is that, like, tell me the person that doesn't deserve to be as healthy as another person. I mean, that just doesn't, that's back to, again, let's get the system, let's get the incentives out of the way so that people can actually know what's available. And there's so many examples, I won't go into them, but I think even for places, because we hope to be an international company, even in places where they may not have access to certain things, it would at least be good to know what things have evidence that they really need and what other stuff, because there's a lot of stuff that's getting done in the United States, which is where my perspective comes from, that frankly could be done away with, and we don't need it to come back. And I think knowing the difference, if you're in a situation where access is key, knowing when it's worth it to move or travel to get the care that you need and when it's probably not going to benefit you, I think is at least a place to start until we can begin to get access to everybody.
Well, even as you mentioned before, taking like, 15 to 17 years for stuff to filter out and become part of the general knowledge is too long, especially when that information exists elsewhere and can be used to supplement people's knowledge. So, and I think, that again leads into kind of the next piece here, and we've talked about a few of them, but, given your unique perspective as an emergency room physician, what are some problems with like the current health system, let's say in the United States, or in general, internationally, that you really firmly think the blockchain can kind of directly address?
Yeah, I honestly, the part that I think is the number one thing is transparency. Whether in the United States or international Canada or internationally elsewhere, the reality is, I think we've gone through a recent period of time where it's hard to know who to trust. Speaking frankly, I'm not sure how this has been addressed internationally, but in the United States, often healthcare decisions were based upon political affiliation more so than actual medical information, and that should never be the case.
Oh yeah, yeah.
That's where we've erred, and that's where I think the transparency of the blockchain and Web 3.0, when done right, is really a major advantage. And that's true for everything. Like, and not just like what I'm talking about is we're really trying to be world changers and flip the model of healthcare. Instead of going to a centralized health system and physicians and the government or payers who are taking care of it make the decisions, to people and directly to them. I think there's a lot of really good reasons why we should do that. And on the flip side, I think there's a lot of good uses within the traditional health system for people to use Web 3.0 themselves. Let me give you a simple example. I recently left my position as a partner in a giant, physician group, and so moved. And as we were transitioning with insurance, took our insurance with us. Now, we had paid for our insurance, but when we went to pick up my daughter's medication, they said that we weren't in there. And my wife's like, Adam, what? It says we're not in there. I'm like, well, I don't know what to tell you. I can see that I paid for it 2 weeks ago. And I look, and it says that 7 to 10 business days are required before they will actually show up. Now, in the world we live in, who thinks that it is adequate that someone should have to wait 7 to 10 business days for a transaction that has already been confirmed, already been done?
Oh yeah, it's centralized. It's there. It's in the system.
Everybody knows
it's not in the system. Yeah.
And we're talking about healthcare. We're talking about in this case, this is a cancer medication for my daughter.
Mm-hmm.
Administrative inefficiencies are absolutely unacceptable when they prevent people from getting the care that they need.
Oh, for sure. And we're past the point of somebody, mailing it to somebody and somebody else typing it on a typewriter and mailing it to someone else and putting it in the file. It's way past that. There's no excuse.
Yes. So I think that is where, beyond what we're planning to do, because like I said, we also have a telehealth option that I failed to mention before. But the reality is like that's not unique to the blockchain. That's something that's available on or off.
Oh, yeah.
But the blockchain has the ability to have people trust transactions and have them happen quickly and not need this administrative centralized bureaucracy slow things down in a way that frankly is not to anyone's interest, unless you're part of that. Then maybe those jobs change.
Maybe there's some profit. Yeah.
Yeah. But in reality, I think that wasn't why it was created. And I think that in my experience, in the health systems, people are trying to do the right thing. It's just that for whatever reason, sometimes momentum makes it challenging. And I think that, so there's so many applications. And also, here's another one that I love as a researcher. Once people have decentralized control of their health information and are informed, the biomedical statistics and the science is actually relatively simple. You can plug and play a lot of things. And so I love to imagine a future state where people can come and they don't know who they are. They just know that they might see, for example, that they're a 45-year-old male somewhere, but that doesn't tell them who it is. And people can organize themselves in groups that they trust.
Oh, sure.
And then they can talk and coordinate amongst themselves. So let's give an example. Say you and I both have the same condition, and it's unknown as of right now whether or not taking a medication is going to really help that or not. Maybe the risks outweigh the benefits. We don't know. That's typically, we rely upon pharmaceutical companies to do that research. Well, pharmaceutical companies, well-intended as they are,
biased.
Yeah, little biased, right? Like huge bias. And that doesn't mean they're bad. It just means that's their perspective. And we might not trust the information that comes out of them, even if it's accurate, because we don't trust that they can overcome their financial bias and tell us the truth if the medication didn't work.
And we do know, that pharmaceutical companies have been known in the past to reconduct trials until they get the statistics for that specific trial that they would qualify for that p-value, for that statistical significance to show efficacy. So in the past, it's difficult. Even with regulations, people don't trust it. And you see the distance from science in society right now, which, is probably beyond the scope of this podcast. But
yeah. So you gave a few examples. There's ample examples of how allowing someone with a very strong self-interest to conduct the trials may not give the evidence and actually answer the questions that we want. And the other part is I think people should be more involved. We know that they're trying to do this, but people should be more involved in what's the outcome that you actually care about. What outcome? What are you trying to achieve by taking this medicine? Here's an example: blood pressure. Nobody really cares what the number of the blood pressure is. What we care about is that number is associated with whether or not I have a heart attack or a stroke or kidney problems or other cardiovascular problems. And so it's not so much this, what we call a surrogate marker, or this in between, like what's your blood pressure. What we care about is if we have a heart attack or these other things.
Right.
So
the outcome.
Yes, the outcome. So to have patients involved with organizing this, and then to have companies or even pharmaceutical companies or different people come to them and plug in a way that they control, and they have as much or more say than those that are organizing it. I think it flips the model in a way that's in favor.
Bottom up. Yeah.
Correct. And so I think there's a world where we can say, hey, we can create our own information. You decided that you're going to take this medicine. I decided that I'm not. Let's just follow our groups for 30, 60, 90 days,
sure,
a year, whatever the timeline is we think we need to follow. And then let's look and see who did better. If it's the same, then why would I go take the medicine if we're the same? If it's better because I took the medicine, but terrible risk factors, and I don't want to take those risks, then at least I'm informed. So I think that's where the DeSci movement of bringing science to the people in an objective, transparent way where you can't manipulate the numbers for your own potential bias is really a huge space in Web3 blockchain technology with medical science.
Well, and given the transparency, I imagine how awesome it would be to get that data that's already anonymized, to be able to run those numbers. And you see a study that's run, you don't have to ask them for their numbers and how they ran their study. You can just go to the blockchain, get those, those samples, run it yourself, do your own modeling, and with the same data, and really double check it. I think, and those different combinations for people who wouldn't have the ability or resources to run such a thing, so it really opens up that, the accessibility of research in general. Which I think is very cool.
Yeah, for sure. I think huge opportunities. And I'll say one thing about people worry about data security. And I think the blockchain's not foolproof. There could be data breaches.
Sure.
Now, that being said, the question is do you trust someone else?
Yeah.
And the current status of the way information is stored, or the blockchain and yourself, and how you would plan to use your own information? I think, again, it's back to weighing the risks and the benefits, and there are very strong benefits to moving to a Web3, own your own health information. I mean, the health information factor is one that's really interesting. And in the United States, they talk about this HIPAA law. And honestly, most people don't understand why that law was created and why it's frankly irrelevant for most questions. But the bottom line is that law was created so that someone else couldn't use your data to do something that you didn't want them to use it on. Right. It's not created so that you can't use your data to do whatever you want. I mean, it's yours. Everybody agrees that your health information is yours, but the number of gates and barriers to get it and move it efficiently have been pretty substantial in the past. And I think that's where, again, that's another solution that Web3 and the blockchain, I think, poses some pretty great advantages.
Yeah, for sure. Absolutely. And I think, and plus you're trusting, centralized entities with your information. Leaks happen all the time. It's not like, at least this way, it would be kind of a decentralized format that's you would have immediate access, and it would be, ideally anonymized. So absolutely. And I guess so those are some positives about what the blockchain, I think, can do for health and wellness and the whole system. What do you think some of the negative effects are that crypto and the blockchain in general have had on our health? And I mean, there's some physical factors and probably and some mental ones too, right? I mean, as we all have seen.
Yeah, I mean, I think it's a really good question. Is that especially as we hope to bring with Galvan, like the pros and cons, benefits of everything. The hard part is we're new. Health and wellness is new. When it gets to healthcare, if you're healthy, I think the risks are low. The reality is we know for people who have chronic illnesses and new problems, there's a lot of things to be worked out, and there's a lot of learning to be had. And so we will still be, I see a future state where we're much less reliant upon centralized systems, but we still need them. Where I live, I still need insurance in order to be assured that I can get the health care that I need, that my family can get the health care that I need. So we're still dependent upon that system with its strengths and limitations. And so, I think as with any big change or shifts in things, healthcare needs to be cautious as we move forward, because I mean, you vote with your feet, and I'm all in. I think this is a way to really solve some problems that aren't solvable in the current system. But again, I think there's a lot to be learned, and I think making it accessible and easy to all, obviously, if you look at the demographic of people that are interested in the blockchain in general and Web 3.0, they're not primarily in the elderly population. That's where most healthcare problems come. Now, does that mean it can't help them? No, that doesn't mean that at all. It just means that your ability to interact with Web3 and online information in general, it varies. And so I think that's a risk. Is it's currently not equitably available or of interest to everyone. And so I think it brings may get rid of certain problems that we have right now, but again, not everybody's hip to the Web 3.0, and so until they are, it's not going to help them. And so that's one of the risks that needs to be taken into consideration.
Yeah, no, I agree, and I think it's a big barrier with crypto, blockchain in general, right? I mean, you look at the amount of people in decentralized finance versus centralized, or even compare that to the regular financial markets. It's so tiny, and DeFi itself has done a pretty lackluster job of bringing people in because it's hard to use and hard to figure out. But so was the internet in 1995 or even earlier, DARPA, and it was a shamble. But eventually, things caught up. It became easier to use, and who's not online? Grandma's on there, like, for sure. So it does evolve and it does change, and it's got to start somewhere, for sure. So
yeah, I mean, I think it's good, again, that people need to be realistic about what things can do. This is not and here's my honest opinion of the fact is, I think there will be a time where we will be amazed that we weren't using this technology.
Yeah, how would I be able to do this without,
It's like somebody else used to control your information and you had to ask for permission to get it.
Yeah.
And you didn't know what the best treatments were or why someone was potentially giving you a certain medication. Like, yeah, that seems crazy. Well, that's the way we're currently living in. And at the same time, I think, like you said, the risks and benefits the benefits just far outweigh the risks. I mean, I just think it's something that will benefit everyone, but it's not a magic bullet. People still will get sick. People still will have terrible diagnoses that we don't know how to cure yet. But I think, in my experience, when you're hit with those most challenging moments in health, which are terrible, but sadly, all of us will be there if we haven't already with our family or our friends or at some point ourselves. The biggest thing we want to know is that we've been given all the information and all the options that anybody else was given. That brings confidence. That brings peace. That's where we talk about wellness. I've met some people who have really crummy diseases that are really well off. They're well in my definition of wellness. And there's some people that are pretty healthy when it comes to medicine that are not well at all. And I think that's what we're trying to do at Galvan is help. It may not be for everyone. Sadly, if I'm honest, I've met some patients where I ask them, "Hey, what medications you take?" I don't know. They don't really want to engage in their health, and I would love to believe that we'll motivate them to do all the right things. I think that's unrealistic, but those who want to take ownership, those that want to have the information they need, those that are willing to at least seek something that can help motivate them to do the things that they have the desire to do, that's where Web3, that's where Galvan comes into place, where we can give you some tools, give you some motivation, give you some information to actually take ownership for your health. And that's our goal, is to help people to own their health and get the information that they want in an objective way, to house it in a way that's protected and safe, and so that you get to decide what it is, so that when you go interact with the health system, you're prepared to ask the right questions, to get the input from your physician and others, so that you're confident in the decision you're making. And that's future state that I think is really exciting.
Yeah, no, fair enough. And you mentioned those people who aren't necessarily immediately interested in their own health, that they don't know the medications they're on, and I wonder at times like that, I usually surmise it down to kind of a skill problem. Right. I mean, imagine they have access to that information. They can learn it. They get there. It's out to them. They're educated about it. And then with that comes care, comes the motivation that you can see externally. So I think, having that available for, the common person is, and having that out and commonly referred to and accessible, can help jumpstart even those people who might otherwise be resistant, especially if they're able to find it on their own, or they hear about it, and it's they discover it, and it's not somebody pushing it on them, for patients come to see me for an hour, and it's like, what impact do I have really? But if they they have access to that anytime they want, and they know they can go and look, they're probably going to, at least most of the time.
Yeah, well, that's the hope. I think there's different people on different ends of the spectrum of readiness to change, readiness to adapt, readiness to do their thing. We know that's always, that's human nature. That's something that always exists. But I think this is a new tool, provides new opportunities, and in a way that I really think can be beneficial to anyone willing to take the plunge. And I think, I will say, as part of a shameless plug, this, Shylo, but we just came out with our light paper, and I think I'd love for people to go check it out. We'd love for people to tell us where we got it right and where we got it wrong.
Sure.
And I think, our mission really is, as I mentioned, to help people to be healthier and to give them some tools they may have not have had in the past, some motivation and information in a way that isn't there. And we're really excited about that. And I think that's the beauty of this new technology. And I think we look forward to working with anybody that has that same mission. And so I think we hope that you and others will come join us and help us get this right.
Absolutely. And yeah, I did check out the light paper today. So yeah, I can recommend go take a look. And if you like what you see, you got some feedback. Of course, that's what this is all about. This is what the blockchain's all about, is feedback, working together, collaboration. And so yeah, I think it takes a village.
Yeah, for
you
sure.
know. And yeah, it's interesting because often crypto gets associated with a lot of negative, especially mental health things like depression, anxiety, as well as even greed. We got the fear and greed index, right? um, and so it's interesting to be seeing it being modified or kind of tailored to a more health and wellness focused mission, the blockchain in general. So I think it shows us what it can really do.
Yeah. Yeah. I mean, I think back to what we mentioned a little bit earlier, like you said, the blockchain doesn't get rid of greed. It doesn't get rid of some of the things that in our inherent natural human being state may present challenges for sure. Like if we're addiction prone and all we do is sit and look at our assets, whether in traditional financial markets or crypto markets, the reality is that's unhealthy. That's unhealthy behavior. And certainly the appeal and the ups and downs that are a little quicker in the blockchain crypto world certainly can cause some mental health and stress on people. We speak of we're in a lull at the moment. It'll come back. We're all hodling, but the reality of the matter is again, that's back to being realistic about what tools can do and what things can do. And I think there's pros and cons to everything, but I think when done right, the pros far outweigh the cons when it comes to health and wellness and the tools the blockchain provides.
Yeah, no, completely agree with you. So yeah, it's been really awesome having you on this podcast. And yeah, like if people want to learn more about Galvan, where should they head?
Yeah, Galvan.health. That's where we are. That's our website. And you can join our Discord or our mail list, or come join us and be part of our network. Love to have your input, and we hope to make this again available and helpful to everybody. So look forward to seeing you and hearing your input.
Yeah, great. And always, if you have feedback about the podcast, you can head over to the Elk Telegram, and that address is t.me/elk_finance_chat. So feel free to head there, or comment on our Twitter or anything like that. We're always welcoming feedback. So I hope today was really full of information for you, and there was some learning. I certainly learned some stuff, and it's always great to hear different perspectives. So I really appreciate having you on, Adam, and it's I thought it was a great discussion.
Well, thanks for having me, and good luck with everything. Hopefully,
all right.
See you soon.
Thanks so much.